The path to a great recovery begins long before surgery. You'll meet your guides, your surgeon, anesthesiologist, and nursing teams. We'll do labs and checkups to make sure everything is ready. It's important to follow instructions about which medications to take or pause. Use special soap to fight infection and a shower chair for less strain and wobble. Nourish your body with good food to build strength for healing. Stage your home before surgery with clear paths, raised essentials, and safety aids. A reacher and bedside table help prevent twisting and keep items handy. Pack comfortable clothes, essentials, and something comforting from home. Remember to stop eating and drinking at the time we give you, and remove nail polish. On surgery day, we'll get you settled and start your IV. Feeling nervous is normal. Deep breathing or calming music can help. You have prepared. You are strong, and we are with you every step of the way. Let's begin your healing journey. But before we go further, let's explain what the surgery actually does. The surgery stabilizes and aligns the spine, but every procedure carries some risks. Let's see what doctors mean by complications and how they prevent them. Infection is an uninvited guest, invading the body's clean house and causing chaos. A post-surgery risk. Our layered defense: chlorhexidine, sterile tools, and antibiotics. We manage surgical blood loss with solutions like transfusions. Think of it as a river running lower than usual. The flow slows and the system feels the strain until the balance returns. Think of nerve damage as a frayed wire. Signals fail, leading to numbness or weakness. We reduce this risk with precise technique and continuous neuromonitoring. Think of it as a live dashboard for your nerves, monitoring signals and alerting the team instantly. Implants can loosen or break, which may require revision surgery. It's like a hinge that wears out over time. The structure remains, but stability is lost. Non-union is a failure of the bones to fuse, requiring a new approach to achieve proper healing. It's like two train cars that are close but never coupled. They don't move together. Post-operative pain is common and should ease. If not, we add meds starting with non-narcotics for severe pain. A patient-controlled analgesia machine delivers tiny intravenous narcotic doses. It's like having your own computer game where you can battle the pain away. We prevent blood clots with early mobility and medication when needed. It's like a traffic jam inside a highway. The flow stops, and everything behind it feels the pressure. Anesthetic risks exist, including medication reactions. Safety is ensured through preoperative screening and constant monitoring. Like an allergic reaction, responses can be unexpected. That's why we test and monitor closely to keep you safe. These complications are possible, but overall uncommon. Your team plans for them and monitors closely during and after surgery. They will manage with proven safeguards. You will just have to follow your plan and scheduled visits. Welcome back to your life, stronger and ready for the future. Let's talk about your life as your surgery becomes a completed chapter. Surgery is behind you. Now, let's take the first recovery steps together. At first, resting feels like the safest choice, but staying still for too long can lead to other problems. This is why moving is your first step. Walk often as soon as you're cleared. Your body will feel sore, so stay ahead of pain with alarms and report any spasms. Medicine helps us listen and soothe those signals. It takes courage to start, but that courage is your greatest strength. Your routine is simple. Make sure your wound stays clean and dry. After 2 days, covered showers are okay. No baths. For easy fatigue, use short rinses or body wipes. Your job is to protect the healing inside. No bending, twisting, or lifting. With every step, you aren't just healing, you are building a new foundation of strength. And you never walk this path alone. We are right here with you. And those feelings show up in small moments, even during everyday activities.
During group work, I tug at my shirt. I worry my surgery scar is showing. Do you think I look ugly? Later, I keep looking behind me. Who saw? This isn't just about a scar, it feels deeper.
This is what body dysmorphic disorder, BDD, can feel like.
BDD is when a flaw seems huge to me, but others may barely notice. With scars or braces, I can feel exposed or judged. For years I hid, covering up my body and seeking reassurance. Sometimes I check the mirror over and over. Other times I avoid mirrors completely. The cycle feeds shame. But sharing my story turns the scar into strength.
Treatment often uses CBT or medication. Support from family and friends helps. Scars tell stories of strength. And if worries don't stop, it's okay to reach out.